Now I am going to proceed with the pediatric resuscitation. So this involves a child or an infant who needs immediate resuscitation. So basically, the steps in doing this procedure is just the same with the adult CPR. The only difference is the number of hands or fingers used in the chest compression. So to begin, we'll still have to check the environment, make sure that the scene is safe. Next, we'll have to check the patient's level of consciousness. And if the patient is not responding, then we'll have to activate the emergency response system. Baby, can you hear me? Baby, can you hear me? Sir, in black shirt, please call 911 immediately. We have a patient here in need of immediate help. Now, after doing that, we'll have to check the patient's ABCs, the airway, breathing, and circulation. We'll have to open the patient's airway. So, if the patient is wearing a constrictive clothing, we'll have to loosen it up. We can also do the head tilt, chin lift to still open the airway. Now, after doing that, we'll have to check for the patient's breathing using the look, listen, and feel method. Look for the chest's rise and fall. Then listen for breath sounds, and then feel for respirations of air. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the patient is not breathing. I'm going to give the patient 2 rescue breaths. I'm going to get my face mask, cover the patient's mouth and nose with it, and deliver 2 rescue breaths. So after doing that, check again the patient's breathing and pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I see that the patient is not breathing and has no pulse. I am now going to proceed with doing the cardiopulmonary resuscitation. So my patient here is an infant. Infants are within the age range of 1 month to 1 year olds. And so in order to deliver chest compressions, we'll have to use 2 to 3 of our fingers, or we could also do the 2 thumb technique, wherein we encircle the baby's body using our hands and then let our thumbs rest on the chest area of the patient and then start the compressions. But I'm going to use the 2 to 3 finger method. Locate the lower breastbone of the patient just below the nipples, and then start giving chest compressions at a rate of 100 to 120 compressions per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After doing that, immediately give the patient 2 rescue breaths. Now, we'll have to do this compressions and rescue breaths until the help arrives, or until the next responders arrive to take over. Now, ensure that in doing chest compressions, there is a complete chest recoil, and then the depth of the compressions is only at 1 to 1.5 inches, because we don't want to fracture the baby's bones. Also, for every rescue breath, there should be a visible chest rise. Now, if the patient is a child, so children are within the age range of 1-year-olds to 8-year-olds, we'll have to perform the chest compressions using one hand. Place the heel of one hand still at the lower half of the breastbone, and then give the patient 30 compressions, 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So still, the depth of the chest compressions should be at 1 to 1.5 inches, and then give the patient rescue breaths. Now, after doing that, continue doing the cardiopulmonary resuscitation for at least 5 cycles, and then check the patient for signs of return of circulation. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, if the patient already has a return of circulation, we have to place the patient in the recovery position. So how do we do the recovery position? We'll have to place the arm that is nearest to you in a right angle, and then grab the hand that is at the farther side. Place the back of the other hand on the patient's cheek, and then hold it there. Grab the farther knee, flex it, and then grasp the leg to roll the patient to his side. That is the recovery position. After doing that, we'll have to wait for the rescue responders, and then after everything, we'll have to document the procedure done.